Hey everybody, this is Beth. Before the episode, I wanted to just let you know that something happened this recording with my microphone, and so my vocals sound really far off from the normal. So did the best I could with them to try to fix it to make it not hurt your ears, but it is not the quality that you're used to. So I apologize and hope that you can last through the episode because Kelly and I have some important things to say. And her vocals sound great, so take solace in her parts and hope you can make it through mine. Hey everybody, enjoy the episode.
And welcome to I Can't Believe It's Not News, your favorite podcast about fake news. I'm Beth.
And I'm Kelly.
Hey, Kelly, how's it going today?
It's going pretty good.
Yeah?
Yeah, back in Oregon, the place where I just really still love to be.
Yeah. It's been really fucking hot, though.
It's been so hot.
Can we do an episode about climate change?
I mean, I don't know, Beth. Is there any fake news about climate change? I've never heard anything about that.
No, yeah, I think it's fine. I moved to Oregon so that I could live in a rainy place and not have 100-degree weather all the time. And I don't know what's happening, but it's fucking hot here like all the time.
Yeah, it did finally cool down today. And I will tell you something that will probably make you want to scream because it's made me want to scream. But the AC in my office went out last Wednesday.
Oh, no.
And I have had to still be in the office. Today, I finally cracked and was like, I'm working from home. I cannot do this. This is absolutely insane. But I was promised that someone would be working on it today while I was out. So I'm hoping that when I go in tomorrow, there will be sweet, sweet AC because you do not appreciate that until it is all the way gone.
I am the kind of person who, when it hits 70, I get a little nervous. And the other day I was like, oh, thank God it's only 85 degrees out. And I was like, who am I? Like, who am I to celebrate 85 degrees? That's 85 degrees. Like, that's still way too freaking hot.
Yeah, it's terrible.
Anyway, what should we talk about today? There's something you were talking about. You said something about a 1-year anniversary of something. What's going on, Kelly?
Yeah, so the other day was the 1-year anniversary of the day that the senators in Congress decided to not repeal Obamacare.
How do you know that? Did it come up on your Facebook memories?
I try to celebrate every small minor victory that Congress gives us, and I try to remember it long after it's gone. But yes, I did remember because it was a big deal for me. It was a big deal for me. Because as you know, I work with people who experience disabilities. I have a child who experiences some disabilities. So to me, it's very, very meaningful thing to have healthcare in this country for a myriad of reasons.
So it sounds like you're a Bernie supporter. You think that healthcare should be free for everybody, a big socialist.
I'm a big old lefty liberal who just wants to give healthcare to everybody.
Ooh, that's right. Well, hey, I pulled up a meme for you. It's a meme of Bernie Sanders, and it has, at the top, it has the U.S. national debt, the debt per citizen, debt per taxpayer, the U.S. federal spending, and the U.S. federal budget deficit. And then it has a picture of Bernie Sanders. Now, I'll tell you, all those numbers are, of course, quite high and probably extremely out of date because they change by the second.
Right.
And it says, looks like the perfect time to implement free healthcare in colleges. So this meme is indicating that we already owe a lot of money. And if we implemented free healthcare in colleges, as per Bernie's plans, that we would be adding to the deficit and adding to the debt. And what do you think about that, Kelly?
Well, it's funny you should ask about that because just this week, pretty much on the anniversary of the non-repeal of Obamacare, there was a new report that came out from George Mason University, and they were studying Bernie Sanders' plan for Medicare for All and found that it would cost us $32.6 trillion over the next 10 years, which is a shocking amount, right, Beth?
Right. No, that's totally. Well, first of all, I want to say one thing is that I think George Mason University had the right idea. For the 1 year anniversary of the non-repeal, you don't like get a cake or ice cream. You get a report.
Yeah.
I think that's perfect. Good job.
Yeah.
Good job, George Mason.
I'd imagine that it's probably 32.6 trillion pages long as well, because most science reports are. But yeah, so that was the figure that they came out with for the next 10 years. And they are a libertarian think tank. This it's the Marikatis Center, which is at George Mason University. Does have some funding from the Koch brothers. And I will say that what they found was that the total spent over the next 10 years, that $32.6 trillion, is actually below current projections of what we would already be spending through personal, businesses, states, government spending. That's about $2 trillion less than we were already projected to spend.
Okay, wait. So you're telling me that what this report found is that we could all have free health care and it would actually cost the government less money than us paying for health care?
Yes and no. It would cost the government more money, but it's going to cost all around less because the costs normally are federal, state, businesses, and individuals. So when you wrap all those costs up in one thing and you have Medicare, which already has all these, they already have all of their base numbers for what they charge for almost everything, because they already have that in place. They already have that insurance plan in place. So what they're finding is that this is $2 trillion less, and it will also cover an additional 30 million citizens.
Wait. Okay, so I have a question.
Yes.
Just a random question. This popped in my head. Is there, do you think, any studies that support the fact that when people are healthy and have access to health care, they are able to work and pay taxes?
No, I think that that's crazy, Beth.
Oh, I'm sorry.
We're all going to get healthcare and then quit all of our jobs.
Right. You know what? I have to say this. Okay. I'm gonna go here right now. So I have a regular job, right? And I have to do that to pay the bills because this podcast does not pay the bills, right?
No.
And part of the reason that this podcast doesn't pay its own bills is because we don't have time to commit to being like full-time podcast producers and like going out there and taking this podcast to the next level. We're literally just like waiting for you all to share this with your friends and family, for God's sakes, and get them listening for us because we don't have time.
Right.
But I have often thought one of the biggest things that would be a holdback for me to ever transitioning to a creative career where I could do writing and podcasting and all that kind of stuff is healthcare. And that I think about it in regards to the fact that America is supposed to be this land of opportunity where people are creative and start businesses and get out there and do the things that they want to do, and they're entrepreneurs. And if we had healthcare for everyone, that would encourage that and would help people to live their dreams and not be stuck in these jobs that they work because they have to. And healthcare is a big part of that. When I look at what my employer pays for my healthcare, you start to choke a little bit because when you think about your salary, if you had to replace just your salary, that's one step of it. And then you have to look at, oh my gosh, but then I have to replace my benefits too. Yes. And so actually I don't make X amount of money. I make X amount of money. And wow, I need to stop complaining about my job, because there is some benefits there that you don't always think about how much it costs. So anyway, that's my thing. I want universal health care so I can be a podcaster. Come on, people. Come on.
I will tell you, Beth, that this is about 3 years ago. About 3 years ago, my husband was laid off from a very good job.
Mm-hmm.
And he couldn't immediately find a job in our area. So for 1 year, he worked as a freelancer. And our biggest challenge was healthcare because we do have a child who has a disability. So it's, even though we're guaranteed insurance, you're not always guaranteed cheap insurance.
Right.
So we did have to go through the exchange and go through the state-run programs and find our own insurance and do that. And it was difficult, but it wasn't as difficult as I originally anticipated it would be. And it was expensive, but it wasn't as expensive as I thought it was going to be either. Although, because when we left the marketplace, because he did get a regular full-time job, it was our costs significantly jumped. They went from like $700 a month to $1,000 a month.
Oh, yeah.
Yeah. So we did experience a very significant jump. And healthcare was one thing we had to make sure we had. So we had a very good plan.
Right.
So we weren't paying a lot of out of pocket. But it was super nice to know that there's at least a way to get it if you don't have a regular full-time job, or if you're a contract worker, even.
Yeah.
But I agree. I can see a lot of, I know that before that, my husband had said he might think about starting or his own business or becoming more independent freelancing. And after that year, it really taught us this is not where we want to be.
Yeah.
It's hard.
And because of healthcare. Thanks. Okay.
Yeah.
So you brought up something there, and I want to talk about really quick so our listeners have this knowledge while listening to us talk today. I want to talk about the difference between Medicaid and Medicare. Are you ready for a little lesson on
I'm looking forward to it.
Medicaid versus Medicare? Yes. So I'm going to have a couple of segments on this today, but welcome to Insurance with Beth Vaughn. So while they sound alike, Medicaid and Medicare are two different programs. And I found this article by Investopedia, and it's literally called Medicaid versus Medicare. Good title. So Medicare is a health insurance policy that's offered to the senior citizen set, along with people under 65 who are disabled in certain ways. This is considered an entitlement. That's what the article says. If you paid Medicare taxes on your earnings while working, you are automatically eligible for Medicare at age 65. It is not income-based. So that's where if you're working and you have paychecks and it's taking out that Medicare every month, that's why it's the same like Social Security. It's putting it into a fund, and then you get to access that fund because you were somebody who put into it. I did see during my research for tonight, there were some memes about there that people were like, well, if I'm not eligible for Medicare, how come it comes out of my paycheck? Okay, yeah, this is how it works. So you have to put in, and then you get to take out when you're older, when you need it. Okay? And you probably have heard this. There's 4 parts to it. There's Part A, Part B, Part C, and Part D. And I'd heard those before. I didn't really know what it meant because I'm not 65 yet. Part A covers hospital care and the cost of being in a medical facility. And then Part B basically covers everything. So it's like doctors, medical tests, procedures, and there is a monthly premium for that. So usually A is free, B is not. And then there's Part C, which is Medicare Advantage, which is an alternative to Medicare coverage, and it's administered by private insurance companies. And then you have Part D, which is prescription drug coverage, which you are required to pay a monthly premium in most cases. So it's not a comprehensive health insurance plan. We're going to talk a little bit about gap coverage later on today. People have the donut that they use to, because it covers a lot of stuff, but not everything in the middle. Okay.
Right.
And then we have Medicaid. Medicaid is a public assistance program based largely on financial need. It's paid for using public funds collected through taxes. So unlike Medicare, which is a federal program, both state governments and federal governments fund Medicaid.
Right.
So it's different in each state. I know in Oregon, it's called the Oregon Health Plan. Yeah. We have that. We have, the women and children, I think, health plan too, that covers people when they're pregnant or small children, that kind of thing. So it's probably something different in your state that it's called.
I think in California, it's Medi-Cal.
Great name.
I know. Yeah. In Florida, I know it's Medicaid.
No, in Florida, it's go fuck yourself.
Yeah, it is. It is.
We're not paying for that.
It's called tough shit. Take a Tylenol.
Right. So here's some of the reasons that you could fall into that group. One is you're pregnant. You're a parent of a minor or teenager living alone. You're aged, blind, or disabled. Aged means over 65, FYI. You don't have disabilities, no children under 18. The Affordable Care Act gives states the opportunity to provide Medicaid to low-income individuals under the age of 65 without a disability or minor children. This is important. That's a big thing. Maybe that's maybe a little bit about what Medicaid expansion was about. I don't know.
Yeah, a little bit.
Coming up on Insurance with Kelly. Okay, so that is your basic difference between Medicare and Medicaid.
Yeah, and I just wanted to put in there that elderly care, especially nursing home care, is paid through Medicaid for the most part, because you'll find most of those assisted living facilities, they can be somewhere between like $8,000 and $10,000 a month, some of them, and there's just no way that people can pay those kind of prices. So a lot of time that comes from Medicaid.
And you can actually qualify for both. You can be on Medicare and Medicaid depending on your qualifications. So I have another meme for you, Kelly.
Oh, good.
This one is not fake news, surprisingly. I verified because I was like, please let that not be true. It's true. It's a screenshot of a quote from Kellyanne Conway, our favorite person. She said, "Those on Medicaid who will lose health insurance can always get jobs." Oh, thanks for letting us know how that works, Kellyanne Conway. Ted Lieu, is he a senator or is he in Congress? I think he's from Hawaii.
I want to say he's a representative.
Yeah, I think he's a representative too. So he responded and said, "Dear Kellyanne Conway," I love that he used her full name there. "Perhaps the elderly in nursing homes can go work at all the fake coal jobs that @real Donald Trump keeps promising." Which is a very good response. There is another one. I didn't screenshot this one, but it's like basically somebody pointing out that there's 30 million children on Medicaid. So you can't. That's an unrealistic expectation that people on Medicaid can just go get a job if they need health insurance.
I think you're really underestimating the cold, cold heart of Kellyanne Conway. I mean, child labor laws should be the next thing on her list, on her evil Wicked Witch of the West list of things she's going to get rid of.
I will tell you one thing about her that surprises me is that she's still there. How is she not gone yet? I don't
know. I don't know. She has not, Beth, she hasn't had any real big scandals. Like, she says terrible things.
Yes, she does.
But she's not had a big scandal that they've had to, I mean, they really only leave when they have a big scandal or an indictment. An indictment is taking care of several of them.
That's true too.
Oh,
okay,
God.
so Kelly, I'm dying to know. Can you please tell me about Medicaid expansion?
I can. This is so sexy. This is the sexiest conversation I've ever had. So Medicare expansion or Medicaid expansion, and I want to tell you why this is important to me. So I have on our last podcast, we talked about how I was in Florida. While I was in Florida, I was talking to one of my best friends who is not Republican, but just out of the blue one day talked about how the worst thing that's ever happened to her is Obamacare because it raised her health insurance premium so much. And I was like, girl, you live in Florida. If you guys had Medicaid expansion, your health insurance premiums wouldn't be so high. And she was like, what are you talking about? So this is where I come to, let's talk about Medicaid expansion with Kelly.
And there is just so much disinformation out there. It's mind-boggling that your friend didn't know about this. And there are a lot of people in these states that don't have the expansion, that don't understand that it's hurting them, or this disinformation is driving the fight to keep it from expanding.
Right. So. And to be honest, this expansion, this non-expansion, it's entirely red states, and it is entirely a moral issue that governors or state senates have taken upon themselves. This is not an issue, and there is many, many, many studies that have been done that show that this is not good for your state. It costs you way more in the long run to not expand Medicaid. Right. not just in terms of healthcare costs, but in terms of longevity and actual health treatments of the people in your state.
So wait, again, if you have more healthy people, you have more people contributing to a society. Is that how that works?
Isn't that crazy?
I don't understand. And so okay.
Yeah.
Okay, please continue. I'm so sorry to interrupt with common sense.
No, it's fine. It's fine. Okay, so what happened is under the ACA, also known as Obamacare, Medicaid eligibility was extended to nearly all low-income individuals with incomes at or below 138% of the poverty level. The poverty level right now is set at $28,676 for a family of 3. I have no clue how you would raise a family of 3 on $28,000, but
yeah,
that's fine. So Medicaid eligibility in states that did not expand those programs is actually much more limited. The median income limit for parents in those states is just 43% of the poverty level, or an annual income of $8,935 a year. So $9,000 in 2018 is what you have to make, that or less to qualify for Medicaid.
I'm pretty sure that in 1992, I made at least that much as a part-time fast food worker in Iowa working. I mean, seriously, like minimum wage was like $2.35 an hour. Like,
yeah, it was really bad.
And I'm like remembering, I'm like flashing back to my tax returns from that time, which were so cute. They were filled out in pencil.
That's amazing.
I think I even made that much back then, for a whole year of working. Yeah. Oh my gosh. Okay.
Yeah. So what happened? And also, people who do not have children, if you are a childless adult, you are not eligible at all for Medicaid.
Okay. Because people who don't have children,
people who
never need help.
No.
Or medical care.
No, absolutely not. Absolutely.
Right. It's only when you have children that they literally send you to the doctor. Got it.
Right. So what happens with the ACA is there are people who fall into this coverage gap, and studies show it's about 2.2 million people fall into this coverage gap where they don't meet the qualifications for that almost $9,000 a year for states that don't have that Medicaid coverage, and the 138% where they have to be above that amount to get the tax credits for the ACA. So there's this coverage gap where they're too poor to qualify for the tax credits, but they're also ineligible for Medicaid because their state didn't expand it.
Okay.
That's a crazy amount of people who are already living in poverty levels, but not able to get healthcare and not able to afford it on the marketplace. So Medicaid expansion has been adopted in 34 states.
Yay.
3 more. I know, it's great. Virginia just did it, which is funny because the other friend I have who now lives in Virginia also complains about Obamacare. And I'm like, well, let's see how you feel in 1 year from now because it just passed, girl, just in June. So there are 3 states that are considering it. I think it's Utah and 2 others. And there are 14 states left with no expansion. So do you want to guess which state has the largest amount of people who are not covered, who are falling into this gap?
Okay, so we know it's not California because California has Medi-Cal, right? Right. So our other biggest states is Texas and super red there. So I'm going to say everything is bigger in Texas, including the percentage of non-Medicaid expansion percentages.
That's right.
Oh, okay, good.
Yeah.
I total guess. I'm not
I know. Not looking at it at all, I can tell. Yeah, so Texas has almost 30% of all of those 2.2 million people who fall into this coverage gap, which is crazy. Florida is the next largest, of course.
Oh, Kelly, I'm sorry to stop you here, but can you tell us what article you're reading from, where we're looking at this chart from?
Yeah, this is from the Kaiser Family Foundation. Their website is kff.org, and the article is called "The Coverage Gap: Uninsured Poor Adults in States That Do Not Expand Medicaid."
That's a good title.
Yeah. Have you ever heard of the Kaiser Family Foundation?
Ironically, I have. So So just to let our listeners know, so that they know this is a credible source. First of all, they've been endorsed by John Lovett from Pod Save America.
Yes.
He's shared some of their stuff. But basically, they are an American nonprofit organization that focuses on major healthcare issues in the nation. And they have been heralded for having the most up-to-date and accurate information on health policy, and they are a must-read for healthcare devotees. They often partner with the Washington Post or New York Times with their public opinion research and documenting views and experiences of the public on health and related issues. So I think that this is a very good source. It's not something that you're going to find on like Media Bias Fact Check because they're not a news organization.
Right.
But this is a good source that you can trust the information that you're getting from them is going to be accurate.
Yeah.
So yeah.
And so that same graph does note that 89% of the states that have not expanded Medicaid and have this coverage gap, 89% are states located in the South.
Wow. Okay. So if you are childless and make $9,000 a year, you do not want to live in the South.
No, 9,000 to, I'm going to say about 28,000.
Yeah.
If you live anywhere in between that, you're probably really, really pissed off at Obamacare. And honestly, you shouldn't be, because it is not the ACA's fault. This is literally your state has effed you blind.
Yes.
And is blaming someone else for doing it.
And unironically is that in the South is probably where you're going to find those lower wages where people are trying to exist on, $15,000 a year.
Yeah.
And that's crazy.
Yeah.
That's insane.
So there's another study, a study that was published in the American Journal on Health Economics from just last year, from 2017, that found Medicaid expansion is associated with statistically significant lower premiums for gold plans, and those are 17% less on the marketplace. The second lowest price silver plans, those are 25% less. I also found evidence that Medicaid expansion decreases average premiums for other silver and bronze plans by about 16 and 13%, respectively. Overall, these findings are consistent with lower expected medical costs after Medicaid expansion removes certain low-income individuals from the marketplace risk pools. Duh.
Oh my gosh.
That's all I thought when I read that was,
I'm going to be right
of
back.
course.
I'm going to go hit my head on a rock.
Yeah.
It's okay because I have health insurance. I'll be right back.
Yeah.
Okay.
Yeah. Yeah. And I mean, if I can just share something personal, my father got sick years ago and he did not have insurance. He was working, but he didn't have insurance. He was working as a roofer and just doing various odd jobs. He was older, so he didn't really have this reliable source of income that provided insurance.
Wait, you mean not all jobs provide health insurance, Kellyanne Conway?
It's for real true.
Wow.
Yeah, especially when you're doing a lot of labor jobs.
Yes.
Unless you're a full-time contracted worker with them, they're not providing your health care. So when he saw the first signs of skin cancer, he hid it from my family and he didn't go to the doctor until it was way too late.
Oh.
So the cancer that took his life could have been prevented. And I'm not the only person who has a story like this. I've shared it a lot because this is one of the reasons that the ACA means so much to me. And it meant a lot to him. He was really pushing and said more than once, if this had been around, I know that I wouldn't be in this situation.
Yeah.
But, I'm not the only person who's had that happen to them. I have a friend here in Portland whose mom went through the same thing. She waited, knowing there was something wrong. She waited a year until she was on Medicare to go to the doctor.
Yeah.
And by that time it was too late. And, those kinds of things shouldn't be happening in a country that considers itself to be one of the best countries in the world. We shouldn't be in this position.
Yeah. There's a reason that preventative care checkups are free on regular healthcare plans. And it's because you save money when you catch things early.
That's right.
On healthcare. So anyway, and then also, of course, that's just sad. I'm sorry.
It's okay. I mean, it's
not okay.
Yeah, I mean, it's not okay in terms of what he had to go through, but I mean, I feel like we're in a better place now You know what I mean?
Yeah.
I feel like I don't want it to ever go back that way, and I will fight tooth and nail to make sure it doesn't go back that way. But I can at least take solace right now knowing that hopefully there are dads out there who now have the opportunity to go to the doctor.
Right.
You know what I mean?
Yeah.
So that gives me a little bit of encouragement. So before I leave Medicare expansion, I did want to mention one other reason why a lot of these people have seen their premiums increase, and that's because of how Medicaid affects hospitals.
Okay.
So a lot of people don't know this, and I knew something about this because of working in a hospital for a couple of years, but I didn't know to what extent this was. So there's something called, and I hear it sometimes called DISH, but it's DSH, and it's called the Disproportionate Share Hospital Program. So as you probably know, if you can't pay anything and you go to the hospital and you have to go to the ER because, say, your leg is broken, you're bleeding out, you've been shot, they still have to treat you.
Right.
They have to give you a certain amount of emergency care, get you stable before they can send you or kick you out of the hospital.
Right.
In order to pay for that care, there is this federal program, this disproportionate share hospital program that partially reimburses the hospital for people who can't afford to pay for healthcare. So those federal funds during the ACA were cut because the expectation is that people were meant to be insured through the ACA marketplace.
And that makes sense.
Right. I mean, you have to cut costs somewhere
Right.
in order to get the money to actually start the program.
Okay.
So those states that did not expand have these hospitals that have been left without relief from the unpaid bills because that funding was cut.
So not everybody has insurance.
Right.
Okay.
And so the cost of the cost of
Premium
going
paying
to
people goes up.
Right. It's not just premium paying people. When you go to the hospital and you see these crazy exorbitant bills, especially in states that don't have that Medicare expansion, this is why.
Okay.
It's because they have to charge more to compensate for the losses that they accrue from not having this DISH program available to them the way that they used. Does that make sense?
It totally makes sense. And I just want to say to those 14 states, do your dishes.
Yes.
Okay. Kelly, I have some really good news.
Yeah.
I just want you to know that Ann Coulter has a solution for everybody. So
oh my God.
I want to tell you about it.
So thankful
I know
that she has chimed in for this very important topic because I can't.
So I pulled this article from Breitbart.
No way.
Yeah. So the article headline is Ann Coulter, a healthcare plan so simple, even a Republican can understand! ! Now, this was back from March 29th of 2017. So this was, over a year ago. But as we are, doing a 1-year anniversary special of the non-repeal, I felt I might need to pull some articles from the illustrious 2017.
Right.
So
This was during their big push, right?
Yes.
Yeah.
Let me read you some things here.
Okay.
So it says, it's always impossible to repeal laws that require Ann to pay for greedy people because the greedy run out on the streets wailing that the Republicans are murdering them. Now, Kelly, I don't know about you, but I have forgotten to wail on the streets that Republicans are murdering me for weeks now. Weeks it has been since I have done that.
I already want to lose my mind because she has started to refer to herself in the third person.
She has. And just so you know, when she says greedy people, she means you. Now, then she says, Obamacare is uniquely awful because the free stuff isn't paid for through income taxes. It's paid for through my health insurance premiums. This is unfortunate because I wanted to buy health insurance. She says, perhaps you're not aware since you exempted yourselves from Obamacare, Congress, but buying or selling health insurance is illegal in America. I don't know what the fuck she's talking about. I'm so confused already. So right now she says there's no free market because insurance is insanely regulated, not only by Obamacare, but also by the most corrupt organizations in America, state insurance commissions. And then she says, I'm talking to you, New York. Federal and state laws make it illegal to sell health insurance that doesn't cover a laughable array of supposedly vital services based on the bureaucrats' medical opinions of which providers have the best lobbyists. As a result, it's illegal to sell health insurance that covers any of the medical problems I'd like to insure against. Why can't the GOP keep Obamacare for the greedy, again, you and me, but make it legal for Ann to buy health insurance? This is what she said. This is how it works today. I'm perfectly healthy. I'd like to buy health insurance for heart disease, broken bones, cancer, and everything else that a normal person would ever need, but no more. And the insurance company says that'll be $700 a month. The deductible is $35,000. Never heard that. No decent hospital will take you, and you have to pay for doctor visits yourselves, but your plan covers shrinks, infertility treatments, sex change operation, autism spectrum disorder treatment, drug rehab, and 67 other things you will never need. Now, under her plan, they would say that'll be $50 a month. Did she just go back to 1952?
Yeah, I'd like to point out that I'm pretty sure she's 50.
Yeah.
If you find any health care plan for a 50-year-old that's $50 a month,
no.
I'm going to tell you it probably doesn't cover jack shit, not to mention broken bones and hospital visits.
That's not a healthcare plan. That's your gym membership. You're at the gym.
Yeah.
You're not at the doctor. Okay, so she says that'll be $50 a month. The deductible is $1,000. You can see any doctor you'd like, and you have full coverage for any important medical problems you could conceivably have in a million years. Wow. So she says Congress don't repeal Obamacare. That was the only sentence in there that made sense. Instead, Congress passes a law pursuant to its constitutional power to regulate the interstate commerce that says, in America, it shall be legal to sell health insurance on the free market. This law supersedes all other laws, taxes, mandates, coverage requirements, regulations, or prohibitions, state or federal. The end. Love, Anne. Then she says, there will be no whining single mothers storming Congress with their pre-printed play cards. What the fuck is she talking about? People who want to stay on Obamacare can. No one is taking away anything. They can still have health insurance with free pony rides. That doesn't happen. It just won't be paid for with Ann's premiums anymore because Ann will now be allowed to buy health insurance on the free market. Okay.
Beth, where are these insurance plans where I can get free pony rides? Okay. I want free pony rides.
Okay, listen. I need to go back to my segment. So this is part 2. Insurance with Beth Vaughn. I just want to take a few moments here and explain how insurance works, just the basics, because this is what a lot of people do not understand when they say, I don't want to pay for your health insurance with my premiums. That is literally how insurance works. Okay, so here's what happens. Sorry, I get a little angry about this. Okay, back in the day.
I understand.
Okay, do you know where underwriting came from? Have you ever heard the term underwriting?
I have heard it, but I don't know exactly where it came from.
Underwriting is an insurance term, and basically underwriters write policies. Okay. So that started back in the day at Lloyd's of London, was a coffee house, and people would put on the board what they wanted to insure. It was like a board, and people would say, I want to insure my boat, and I'm willing to pay this. And businessmen would come in and they would underwrite it. They would sign to it and that's how basically insurance fucking got started. Okay.
Nice. So they would write they would
underwrite it. Okay. Yeah.
Nice.
That's how underwriting got started. Okay. So what underwriters do now, there's no more board. It's not that simple anymore.
Oh, man.
What they do now is it's more about statistics and analytics. So they look at and they say, okay, how much premium do we need to charge in order to cover this risk? And also, what risks can we cover for this premium? So what is going to be a good risk for us to write? So they write their premiums based on what they can cover they write their policies based on what they can cover for a certain amount of premium. Now, she mentioned in here the Department of Insurance. That is correct. Insurance companies are very regulated by the Department of Insurance because the Department of Insurance wants to make sure that insurance companies are solvent. And why would you want an insurance company to be solvent?
Oh, I know.
Yes, Kelly.
It's because if a disaster happens, they need to be able to pay the cost to replace all the things. Right, all the claims. That's right.
They have to pay their claims, right? So
the claims.
When you have an insurance claim, it doesn't matter. We could be talking about healthcare, auto, home. It doesn't matter. It's the same thing. Right. The insurance companies have to have a pile of money And they're actually required to keep a separate pile of money for emergencies. So the Department of Insurance, well, let's say a healthcare company came in and said, we want to write a policy and only charge $50 a month, and we want to cover everything. The Department of Insurance would be like, no, because you would go out of business. Okay. So here's how it works. Let's say you have, let's say your healthcare premiums are $100 a month. Let's just double what Ann said. And you and 10 of your neighbors all pay $100 a month. So $1,000 a month goes into the pot, right? One day, one of your neighbors breaks their leg and they turn in their claim, and it costs the insurance company $800 for the broken leg. Now, did his neighbors pay for that?
No. Didn't they all pay for it in a pool?
Because what you're paying for with your insurance premiums is the offer of coverage in case you have a claim.
Right.
So I think that's a better way to look at it. You have to pay the premiums so that you have access to the insurance. And at the end of the month, you have to pay that premium again to get access for another 30 to 31 days. And over your lifetime, most people will pay out a little bit more than they actually get. But that's what you have to do, because some people will have millions of dollars of health care that they need. And maybe during their lifetime, they've only paid $50,000. So that's how insurance works. Is a pool of money is gathered in order to cover the masses for the big things. Okay.
Right. Which is why Medicaid expansion, see, even I do it. Medicaid expansion, that's why it's so important, is because you're taking people out of that risk pool for the rest of the marketplace. You're taking out people who haven't had insurance for a while, so probably have not had any preventive care and are probably at higher risk for having advanced diseases that cost more. And you get them preventive health care so that doesn't happen. So it's not a systemic cycle that repeats throughout people's lifetimes, and it helps lift people out of poverty. But why would we want that, Beth?
It seem like it would actually lower the premiums of the people who aren't in that high risk pool if you take.
It does seem like that, doesn't it?
So maybe it's actually worth providing some healthcare. And gosh, maybe it's actually worth the government being able to like negotiate prescription drug prices and things like that. I don't know. Those socialist ideas.
You're talking so crazy.
Okay, so you pulled a really good article I want to jump over to. And do you want to talk about the myths of the Obamacare? Because I want to focus on the number 2 one, kind of follow up with some of those things that Ann said.
Yeah, so this is an article from The Balance called The Truth About Obamacare. And we discussed a little bit about it before, but myth number 2 says, under Obamacare, and this relates back to Ann with her glorious points. Yes. Under Obamacare, you're forced to pay higher premiums for services you don't need, such as pregnancy, childbirth, and maternity care. So, again, back to what you were saying, sometimes you're going to pay for things that you're not going to need. So, for instance, most women don't need to ever get prostate testing done.
What?
I know. Can you believe it? We all had ours removed at birth, so we never need to get it checked out. So Obamacare requires childbirth coverage in order to lower overall healthcare costs, and that's because Medicaid pays for 50% of all childbirths.
Ooh, that's a lot.
Yeah, so it costs the taxpayer less to make sure these women receive prenatal care, because then it's cheaper than them going to the emergency room for treatment that results from botched home deliveries.
Ew, that doesn't sound good. You should never associate those words with childbirth. I think the only thing I'm literally, I maybe Chinese food. Chinese food, you can have a botched home delivery, but no to the childbirth that hurt inside. My vagina is now hurting. Okay.
Yeah, it's awful. So, and I'm going to have to look up and find where I read this, but one of the Kaiser Family Foundation articles I was reading earlier, and I will make sure I include this on the blog. I just have to find it. But one of them was talking about the results from different states where they've had improved, let me say this correctly, they've had improved maternal rates of health after a child, especially, and newborn care after birth, So less mortality in both mother and infants, especially in the African American population. And so I will find the actual stats on that and include it on the blog. But, that was really interesting to see as well. And it just always leads me back to, so many people get very, very bad support inside of healthcare. And why? We don't need to be like that.
I'd recently read about this in a couple of articles. I think some of it came to light with like Serena Williams, and I'd read a little bit about it before her birth as well. But I was always surprised to hear about how the U.S. had such a high infant mortality rate, and like, why did we have this high rate?
Yeah.
And it really comes down to it's really high among African American women because they are not receiving the care from doctors after childbirth that they should. And it's not even, it has nothing to do with income. It's literally fucking racism.
Yeah.
Like even Serena Williams had to fight her doctor to get the health care that she needed because she has blood clots.
Mm-hmm. And I think it's nurses and doctors.
Yeah, nurses and doctors, they tend to dismiss pain in African American women. They, and I don't have the article up in front of me, but I was shocked to read this, and it made me sad and angry, but it was basically like African American women are dismissed by the medical fields. They're treated differently than other races, and it leads to more deaths in childbirth for women and the infants. And if we could fix that problem, I think our infant mortality rate would be more in line with a non-third world country. And you know what? Maybe we are a third world country at this point because we're so fucking racist that we can't even listen to somebody who comes in and says, this is my healthcare issue. Because I read this article about this lady. She passed after childbirth, like I want to say it was a couple weeks after. And she had a known health issue. She was herself a doctor and like a scientist doctor that was studying all of these things was so smart, had all these degrees.
Yeah.
And they wouldn't listen to her. And she freaking died.
Yeah.
And it was a single parent. So now grandma's raising the baby. And it was a really long article. And I don't know if I'd be able to find it again, but that was the one that really opened my eyes to that issue. And then the follow-up with Serena Williams with her experience with childbirth as an African American woman in the U.S. is ridiculous.
It is. It's really crazy. And it really brings to light how it's not just sometimes you can say, oh, well, it's more based on class than it's based on race. But I mean,
it's not. In this
it really,
case.
really isn't. And it doesn't appear to really ever be that way.
Yeah. So there you go.
You know what
do
I
you think?
Beth?
What?
I think we should just call it ObamaCares from now on.
And that'll never fly.
I know. Well, they tried to use it as such a derogatory name forever and ever. And honestly, it might go down. I mean, based on the approval rates of Obamacare, of the ACA, it's well over 50%. I believe at the time that that the Senate a year ago, I believe a year ago when they decided not to repeal it, I want to say that it was close to the 70% mark for approval of Obamacare, or at least a negative approval or a negative review of repealing it.
Yeah. I get it that there's some people, their premiums went up, and some people it did affect negatively. And the truth is that you have to step back and think, were those people maybe in the sweet spot before? Yeah. And it needed to be evened out a little bit. And as much as that sucks and is hard, and I'm sure those people didn't feel like they were in the sweet spot before.
Right.
And there were also some issues that needed to be fixed, but there were a lot of things that couldn't be fixed because it was stuff that, what was it? Frickin' Joe Lieberman?
Yes.
Was it what did he kill? The single payer option?
What he killed was Medicare buy-in. So people who were 50 and over, which is a huge high risk pool.
Yeah.
They were supposed to have the option to buy into Medicare as if it was their insurance, and they would just be adding to the premium cost.
Yeah.
And basically adding to the money pool for Medicare. And Joe Lieberman was like, nope, I won't sign off on the ACA if this goes
Right.
in. And then he fucking retired because he is a goddamn coward.
So the ACA is not perfect. It never was.
No.
But it definitely was better than what was happening. There were so many more people covered.
Yeah.
There was so many more people that got to go to the doctor finally. There was a small portion of the population that was affected in a negative way.
Yeah.
And that's always going to happen. You cannot write a bill that is going to make every single person's life better.
Yeah. No, I mean,
period.
We can look back at a lot of the things that we now take for granted that are basic social safety nets. You can look at
Social Security.
Yeah, you can look at Social Security, you can look at Medicaid, you can look at Medicare, you can look at welfare, even things that affected children, even child labor laws. There were tons of people who didn't like that all those things happened. We had a fucking war because some people didn't like that the end of slavery happened.
Right.
You can't go on what you're not going to make everybody happy. And that's not the job. The job is to make the country better.
Right.
And you do that by protecting all citizens.
All right. Well, let's you and I make the country a little bit better by spreading some jam here.
Let's do it.
Okay. Whose turn is it? I don't know. Is it my turn?
I don't think it might be my turn.
You take it, girl.
All right. Okay. So my jam of the week is I just read this tremendous book. And oh my God, Beth, when I was on vacation, I read 2 books. They were both so long and arduous. And I was like, oh, I don't want to do this. The one was very abstract and the other one was just slow. And so when I picked up this book, I was like, yes, it has finally happened. I am finally able to just let go and read. And so it was great. And I really, really recommend it. It's a book called The Power. It's by Naomi Alderman. And it depicts a world in which I'm not a big, huge fan of dystopian futures, but I love the show of The Handmaid's Tale. I like the book. I am not particularly keen on how feminism is treated, and I hate the ending. But this is, if you took The Handmaid's Tale, it's like the antithesis of The Handmaid's Tale because it depicts a world in which teenage girls, young girls, as they're like hitting puberty, are suddenly all given this power. And the power is electricity. And they can, through their hands, they can push out electricity. So say a man is sexually assaulting you, a girl can turn around and she can fucking electrocute him. And it doesn't have to kill them, but it puts women in a position of power, and young girls are able to awaken the power, and older women. So all these different girls have it, and it sort of starts as this choppy story going through the main characters and then gets into what happens when this happens. And it does have that nice thing like The Handmaid's Tale where they're talking about it way in the future and talking about it like it was an ancient civilization. And you get this very ironic conversation between the guy who's writing it and the woman who is sort of his friend who's reading the story, where she's like, so you're saying that men were once in power? No one's ever going to believe that.
Can I tell you why I don't like dystopian stories? This is my one thing. They always have that coffee is dead. That like there's no real coffee anymore in like the dystopian future, you know?
Yeah,
this is like, no, I can't go there. That's too far. It's too far, people.
This is not that type of dystopian. This is just a
so there's coffee, is what you're saying.
Yes.
Okay, then I can read it.
Definitely still coffee, and as you would be a woman in this story, you could have as much of it as you would want.
Perfect.
That's great. But I will give a caveat that they're just as a trigger warning to anyone who's been a victim of sexual assault. There's quite a bit of it in this book. So if that's something you don't want to read, I don't recommend this. Read your other favorite books. I have plenty of other jams of the week you can check out, but not this one if that's going to bother you.
Good one. Thank you for the trigger warning too. Thank you for remembering that. Well, my jam of the week is called A Little Honey, and it's by Nathaniel Rateliff and the Night Sweat. And I am in love with this band. They are so good. It's like a really bluesy rock, and it's just something that I can put on and just listen to their whole repertoire, like in the background as I'm like cleaning or working or doing whatever. But this song has stood out to me. It's really fun. And the lyrics are pretty straightforward. It's not one of those songs where you have to Google, like, what do these lyrics mean? It's literally like,
right.
Hey, I like you. I'd like a little honey from you.
I don't know what they mean. What are they talking about?
Yeah, what are they talking about? What does that mean? So obtuse. Anyway, it's a good song. I like it. Go check it out. And yeah. And hey, if you like this episode, go check us out on iTunes and rate and review us and give us 5 stars so everybody else can find us in the world, because like we said, we don't have time to do this podcast because we have to have jobs where we have healthcare.
That's right.
Heck.
And you can also find us on any other of your favorite podcast apps like Stitcher or Spotify. We're on there. I always prefer Stitcher because I like to speed it up a little bit. But a lot of people like to listen at regular speed, and you can do that on Spotify. There's tons of new places where you can listen. Google Play.
You know what? Sometimes after when I'm editing the episode, I put it on double speed just to listen to make sure everything's okay. Yeah. And in my editing software, when you put it on double speed, it's like chipmunk talk, and it cracks me up. I'll listen to the episode at double speed and just laugh the whole time. Hilarious.
I feel like you'd be okay, but I have a tendency to talk fast, and I feel like I probably sound absolutely ridiculous. You can't even understand a word I'm saying.
Like chipmunks. I will send you one of them sometime. Actually, what we should do is we should post that on our Patreon. It'd be fun to post an episode in chipmunk speed. Just for the hell of it. Yeah.
Yeah, why not?
And hey, so if you want to have access to that, though, you have to go subscribe at Patreon for $1 a month. That's the very least that you can give. You can give more if you want, but the least is $1.
You can give us all the money, and then we can have healthcare.
But hey, also follow us on Twitter and Facebook at Podcast Fake News, and send us anything that you want on email at podcastfakenews@gmail.com. We want to hear your comments. We want to hear your show ideas. We want to hear whatever that we mispronounced or that we messed up on or that you liked. You can send those too. We like compliments.
Yeah. And if you have a topic that you want us to cover, let us know. We'll cover it. If you want us to send a rebuttal email to your uncle because he got drunk at the family dinner and you're like, I know that's not true, but it's not worth my time to do it. I'll pay these girls $1. They'll do it.
It's actually, no, that's $10 a month.
Yeah, that's $10
for the uncle.
It's worth it, though.
It's totally worth it. It is.
And you can also check out our blog at podcastfakenews.com. We have a link to all the articles that we mentioned, as well as links to our jams of the week.
Yeah. And just, some fun stuff. So, Hey, we'll be back in 2 weeks. And until next time, spread jam.
Not lies.